And as a reminder, if you don't want any of your information on the recording or you don't want your screen in the recording, feel free to take your cameras off or change your Zoom name. That's perfectly fine. To reiterate, my name is Raiya Suliman. I'm with the American Lung Cancer Screening Initiative, and I'm going to be talking a little bit about lung cancer screening today. Thank you so much to everyone who's joined. We're so excited that you've taken the time to learn more about lung cancer risk and lung cancer screening. And we're also so excited to be working with Spring Hill EnVision Center and the Jeffersonville Community Housing Authority. So without further ado, we can get this started. Just a reminder, I'm asking everyone to please mute during the meeting so that we don't get any background noise. As always, if you have any questions, feel free to place them in the chat box, which is located on your Zoom screen. And then when we're done with the webinar itself, we can move on to a Q&A session where you can just unmute yourself and directly ask any questions you may have. And before we move on to the presentation, just remember that you can access information about lung cancer screening at any time at our website, www.alcsi.org. And if you have any lingering questions after the webinar about lung cancer screening, lung cancer risk, or anything of that sort, please feel free to email us at info@alci.org. And again, I'll reiterate this information at the end of the presentation. So to get started, I'll introduce ALCSI, the American Lung Cancer Screening Initiative. It's a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. And fortunately, we're a team of over 50 passionate students and doctors located across the United States. So far, we've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. So we hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. So today we're going to discuss both lung cancer and lung cancer screening, addressing questions such as how common lung cancer is, what lung cancer screening is, and how you can get screened. And this is an extension of last week's webinar that some of my teammates did on smoking cessation. So feel free to view that webinar. We'll have that recording posted later. So unfortunately, lung cancer is very common. It's the second most common cancer in the United States, excluding skin cancer, and it's the most fatal. So this graph on the slide shows the American Cancer Society's estimates for the number of new cancer cases in the US. And the graph estimates new cancer cases in 2020 for the 4 most common cancers. And as you can see, it's estimated that approximately 228,820 people were diagnosed with lung cancer in 2020 in the United States. So to put this in perspective, it's estimated that about 6% of people will develop lung cancer during their lifetime in the US. And that means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. So not only is lung cancer very common, but it's also very fatal. And lung cancer is the leading cause of cancer-related death in both the United States and in the world. In 2020 alone, lung cancer was estimated to have claimed the lives of 135,720 people. And this graph on the slide shows the American Cancer Society's estimate for the number of cancer-related deaths in the US. And as you can see, lung cancer is far more fatal than breast, prostate, and colon cancer, causing more deaths than all of those 3 cancers combined. And every year there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. In women alone, we see that every year lung cancer causes more deaths than breast cancer, ovarian cancer, and uterine cancer combined. So from this data, the question that arises is why is lung cancer mortality so high? And the reason lung cancer mortality is so high is because patients are typically diagnosed at a later stage. So this is a graph looking at the proportion of patients with lung cancer by stage. And stage is just a way for doctors to classify a cancerous tumor based on its size, if the cancer has spread to your lymph nodes, and if the cancer has spread to other locations in your body. So currently, most lung cancers are diagnosed at a distant later stage when the cancer has spread beyond the site in the lung where it originally originated. So this graph is based off of data from 2008 to 2017, published by the National Cancer Institute. And as you can see, about 21% of patients are diagnosed at a localized stage, which is an earlier stage, while about 51% of lung cancers are diagnosed at a distant stage or a later stage when the cancer has spread to other locations in the body. And why is this so important? It's important because the stage that lung cancer is diagnosed at directly correlates with someone's survival. So one way that doctors track the survival of patients is by looking at the 5-year survival. And as you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses. And this graph is another way to understand the relationship between the stage at diagnosis and 5-year survival. So as you can see here, we can compare the stage at diagnosis with the 5-year survival. And the 5-year survival for patients with localized early stage lung cancer is 57.7%, but only 21.5% of lung cancers are diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at a distant later stage. And this is why early detection of lung cancer is so important. If we can detect the lung cancer at an earlier stage, the treatment options are far often better and the prognosis is better. So with lung cancer being such a morbid disease, some of you may be wondering why the majority of lung cancers are diagnosed at these later stages. Unfortunately, the majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has grown and spread. And the most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, shortness of breath, and additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has usually grown and spread to a point where it's more difficult to treat and the prognosis is poor. So if the diagnosis of lung cancer has to wait until the patient has symptoms, it's really difficult to catch the lung cancer early. And the question becomes, how do you catch lung cancer early if patients are asymptomatic? And one of the best ways we can do this is through lung cancer screening. So lung cancer screening is done using something called the low-dose CT scan. And if you're eligible for lung cancer screening, it's recommended that you get an annual lung cancer screening. So in the coming slides, we'll discuss what lung cancer screening is, who should get screened, and how you can get screened. So an important distinction we want to make is that lung cancer screening is done using the low-dose CT and not the chest X-ray. We'll get into why we use the low-dose CT scan in a few slides, but the primary takeaway here is that a low-dose CT scan provides more detailed pictures than X-rays and are better than finding small abnormalities in the lungs. So the picture on the left is a picture of a chest X-ray, and the yellow arrows point to the abnormalities in the lungs, but it's really quite unclear. On the other hand, the picture on the right is a picture of a low-dose CT scan of the chest, and the red arrow points to the abnormalities in the lungs. So as you can see, this image is more detailed than the chest X-ray and enables you to see abnormal areas in the lung with greater detail. So the question that researchers wanted to answer is, how effective is the low-dose CT scan at detecting lung cancers at an early stage? And an important lung cancer screening trial, the National Lung Screening Trial, or NLST, tried to answer this same question. So the NLST was a large national study with over 50,000 patients, and the goal of the study was to determine the effectiveness of using a low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. And the study included two main groups. First, a group of patients who received annual low-dose CT scans, and second, a group of patients who received an annual chest X-ray. And by comparing the number of lung cancers caught at the stage that these cancers were caught at between these two groups, the study wanted to determine if the low-dose CT scan was a better method of catching more lung cancers at an earlier stage compared to the chest X-ray. And as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an earlier stage, while the X-ray diagnosed more patients at stage 4, which is a late stage. And this has important implications for survival. Because the low-dose CT scan caught more lung cancers at an earlier stage, these cancers were more likely to be treatable, and the prognosis was much better. So this translates to a 20% reduction in mortality for those who underwent lung cancer screening using the low-dose CT scan compared to the X-ray. And a common concern with any screening test is accuracy. So essentially, we want to know how good the low-dose CT scan is at catching lung cancer. And for every 100 individuals undergoing CT lung screening, 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly don't have lung cancer. So this means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive and the test will not miss your cancer. If we move our attention to the 25 individuals that are positive, 23 turn out to be negative for cancer, primarily with follow-up imaging alone. And this means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. The 2 individuals that have positive test results and truly don't have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening at all. And this means that their treatment options and prognoses are much better. So the results of the NLST were published in 2011, 10 years ago, and several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. And one of the most important of these trials is the Nelson trial. So this is a bit more about the Nelson trial. In February of 2020, the results of the Nelson trial were published, and like the NLST, the Nelson trial had 2 groups. However, unlike the NLST, the Nelson had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at TO, baseline, year 1, year 3, and year 5.5, or no screening at all. And the results confirm the life-saving benefit of lung cancer screening by low-dose CT. In the screening group, 58.6% of cancers were diagnosed at stage 1, a very early stage, and in the non-screening group, 13.5% of cancers were diagnosed at stage 1. So early detection translates into a great reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when you compare that to the no screening group. The Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate was reduced significantly. So we've shown that lung cancer screening significantly reduces lung cancer mortality, but the question still remains, who should get screened for lung cancer? So the United States Preventative Services Task Force, also known as the USPSTF, sets the guidelines for who should be screened for lung cancer. And previously, the USPSTF recommended lung cancer screening for individuals aged 55 to 80 who have a 30-pack-year smoking history and are a current or former smoker who quit within the past 15 years. However, it's important to note that these guidelines were recently updated and the screening eligibility criteria expanded to include more high-risk individuals. So the slide you see now is the old set of guidelines. In March of 2020, the USPSTF released new lung cancer screening guidelines, and these new guidelines recommend lung cancer screening for individuals aged 50 to 80 who have a 20-pack-year smoking history and are current or former smoker who quit within the past 15 years. So importantly, these new guidelines will nearly double the number of eligible individuals for lung cancer screening in the United States, with the most apparent increase in eligibility occurring amongst women and minorities. So as of right now, if you're age 50 to 80, have a 20 or more pack-year smoking history, and are a current or former smoker who quit smoking within the past 15 years, lung cancer screening with low-dose CT is recommended. So these are the new guidelines on this slide. So a pack year, as we mentioned before, is defined as smoking a pack of cigarettes per day for a year. For example, if you were to smoke 1 pack a day for 30 years, that would equate to 30 pack year smoking histories. Alternatively, if you were to smoke 2 packs a day for 15 years, that would also equate to a 30 pack year smoking history. The most important thing to know about pack year smoking history is that it's a tool for a doctor to figure out how to help you. And by calculating your pack year smoking history, your doctor can determine if lung cancer screening is the right path for you. So the new screening guidelines require you to have a 20 pack year smoking history. And now you get to that number the same way, but instead to reach a 20 pack year smoking history, if you were to smoke 1 pack a day for 20 years, that would equate to a 20 pack year smoking history, or you could smoke 2 packs a day for 10 years, and that would also equate to a 20 pack year smoking history. So while smoking is the main risk factor for lung cancer, there are additional risk factors that can increase your risk for lung cancer. These additional risk factors include exposure to secondhand smoke, exposure to radon, exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. And it's really important that we recognize these additional risk factors. And while lung cancer has a strong association with smoking, there are a large number of people in the US that get lung cancer that have never smoked. So it's important that you talk to your doctor about your individual risk. Never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. And because lung cancer has such a strong association with smoking, people often are surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the 7th leading cause of cancer-related death in the US and in the world. More never smokers die from lung cancer each year than people die from ovarian cancer. So this graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked in their life. So it's then further broken down by whether they are a current, former, or never smoker. And as you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. And in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. So right now, if you've never smoked, lung cancer screening is not recommended for you. However, understanding lung cancer in never smokers is a current focus of research. So with the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. In summary, lung cancer is the leading cause of cancer-related death in the US, and it's so deadly because most lung cancers are diagnosed at a late stage when they have spread to other locations in the body. Importantly, early detection through lung cancer screening by the low-dose CT can reduce lung cancer mortality by up to 33%. Currently, however, only 5.7% of high-risk individuals are currently getting screened for lung cancer. And to put this number into perspective and show you how low that really is, we compare the lung cancer screening rate to screening rates for breast, cervical, and colon cancer. All 4 of these cancers have screening tests that are recommended by the USPSTF, but right now, only 5.7% of high-risk individuals are getting screened for lung cancer. That's an extremely low rate in comparison to the screening rates for breast, cervical, and colon cancer. The American Lung Association estimates that if we were to screen every high-risk individuals recommended by the USPSTF in the US, we would save about 48,000 lives. However, we're only screening 5.7%, which means there's a lot of lives that could be saved and are not being saved. And why is that? So the lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. In the next slides, we'll discuss each of these topics, and the important takeaway is that lung cancer screening can help you reduce your risk of dying from lung cancer. So the first potential concern we'll address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. There are a few exceptions, though. Medicare will only cover lung cancer screening until the age of 77. Not all state Medicaid plans cover lung cancer screening, and patients will still pay the usual fees for provider appointments before and after the scan. Unfortunately, not all state Medicaid plans cover lung cancer screening, but here's a map updated in July showing which state Medicaid plans do and do not cover lung cancer screening in. Blue states have state Medicaid plans that cover lung cancer screening. Purple states have Medicaid plans that do not cover lung cancer screening, and pink states don't have information on this available. So the first step to getting screened for lung cancer is talking to your primary care provider, and there are certain questions your primary care provider has to ask and topics that have to be discussed. And one of these is your smoking history. So it's really important that you be as honest as possible about your smoking history, because that's heavily influenced by the screening guidelines. And to find an accredited lung cancer screening center, you can always go to the American College of Radiology's website, and you can type in the state or city you live in to see where accredited lung cancer screening facilities are near you. The American College of Radiology website is listed on the bottom left side of the screen. And this is a map of accredited lung cancer screening facilities near Jeffersonville. And I believe the closest, which is indicated by the red pinpoint, is Clark County Memorial Hospital. So as far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes, and you'll be doing something very similar to the patient in the photo here. One thing to note is that this process will not hurt at all, and because this is a low-dose CT scan, you don't have to use contrast. All that means is that there's not going to be any needles or injections involved, and the low-dose CT scan is a non-invasive, fast, and completely pain-free process. Additionally, the amount of radiation you receive is very low. So during a low-dose CT scan, you'll be exposed to radiation, but the amount of radiation you're exposed to is very small. And a way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. It's just a way to measure radiation and compare the levels of radiation received during different activities and over time. For a low-dose CT, you'll be exposed to about 1.5 to 2.0 millisieverts of radiation, and this is a lot lower than a full chest CT scan, which requires a radiation dose of about 8.0 millisieverts. And to put that into perspective, you're exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and the radiation from the Earth. So a low-dose CT scan exposes you to less radiation than you were exposed to from just existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening is really small. That being said, it's always something that you can discuss with your primary care provider when you're discussing screening. So you've talked to your primary care doctor, he or she referred you to a screening center, and you received a low-dose CT scan. What's next? Your doctor will receive the results of your screening test, and they will follow up with you to go over these results. And as far as results go, there are 3 most likely outcomes. The first is that the scans are normal. And if that's the case, then you should just look into get repeat scans in a year. If the scans are abnormal, but probably benign, then you should talk to your doctor about the next steps. They may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then you will most likely have to undergo additional testing, such as a biopsy. So we've covered that lung cancer screening does save lives, but the question you may be wondering is, can I still get screened for lung cancer during the COVID-19 pandemic? And importantly, is it safe to do so? During the pandemic, the number of cancer screening has decreased significantly, but lung cancer won't stop because of the pandemic. And if you're at high risk for developing lung cancer, it's really important that you get your annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and you can wear a mask during the entire lung cancer screening process. If you follow the necessary precautions like wearing a mask, lung cancer screening during the pandemic is safe. The pandemic should not deter you from getting screened for lung cancer, and if you have any concerns at all, ask your healthcare provider for details about your local lung cancer screening center. Additionally, while lung cancer screening has the potential to save many lives, it's important to address smoking cessation in the context of lung cancer screening. And lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early. So using both is the best way to fight the disease. For every year after you quit smoking, your risk of lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer you have. Another reason that smoking cessation is important is because it's required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be very difficult, and there are a lot of resources for people trying to quit smoking, like the Quit Line and like those we discussed in last week's webinar about smoking cessation. So again, please refer to that webinar. A recording will be up very shortly to go over that. To reiterate this presentation, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is unfortunately the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are currently getting screened. We're working to address all aspects of the issue, and we wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. Last December, our Senate resolution was passed by unanimous consent, and we are working to teach communities across the country about lung cancer and lung cancer screening. So the work is just beginning, but we're really excited to be a part of this journey. We're so grateful to the Jeffersonville Housing Authority and the Spring Hill EnVision Center for helping us set up this webinar. And we thank you so much for attending the webinar and taking the time out of your day to learn more about lung cancer screening. We hope that you were able to leave this presentation with a better understanding of lung cancer and the lung cancer screening process. As we all know, lung cancer is a very big problem. It's common and it's very fatal. But that being said, there are a lot of tools we can use and actions we can take to help reduce lung cancer mortality. One of the best ones and the topic of this presentation is lung cancer screening. And the American Lung Cancer Screening Initiative is always looking to help raise awareness for lung cancer and lung cancer screening. If you have any questions at all, please feel free to ask in the following Q&A session. And if you're interested in helping raise awareness for lung cancer screening in your community, we would love to work together. You can send us an email at info@alci.org or ask during the following Q&A. And this is just a reminder for an upcoming event we have on June 17th at 5:30 p.m. Eastern Time with Dr. Gail Darling, who is a leader in the field of lung cancer research and surgery. So we would love to see you there this week at 5:30 p.m. And I will stop sharing so that we can move on to our Q&A. And I'm also joined by Rusab and Alex Potter, who are part of our team at ALCSI and would love to answer any questions anyone may have.
Great to see everyone. Hey, is it Elm? How do you pronounce your name?
Elma Dina, but you can call me Dina for short.
Dina, what's you have a question?
Yes. Okay, why does it seem like women are more at risk for lung cancer than men?
So why? There is some research saying that women may be have more like genetic susceptibility for lung cancer, and they've shown that women who smoke less are at a higher risk for lung cancer. And then the final thing is women, when compared to white men with lung cancer, women are more likely to smoke less and be younger when diagnosed with lung cancer. And so it's really an ongoing point of research and is one of the reasons why the newest guidelines came out lowering the screening age and the pack your smoking criteria to allow more women to be eligible for screening and to undergo screening. But it is interesting. A lot of people are often surprised to find out that more women die from lung cancer than they do breast cancer every year. But it's really striking and very sad. A great question. Are there any other questions? Oh yeah, go ahead, Dina.
Okay, now next question. Do you think that viruses and bacteria can cause lung cancer? It's a little out there, but you know.
Yeah. So some viruses, some lung cancers are associated with viral infections, HPV, but not as commonly as like cervical cancer or some of your other cancers, but it is a possibility. And one of the additional causes for lung cancer aside from smoking.
Thank you.
Awesome. And we would love, any other questions as well as from, I don't know if I'm pronouncing your name right, Netta or Nita?
Good job. No. Enjoyed the information that is being shared. Appreciate it. And then also, the 17th and then the 21st for the doctor's panel, 5 to 6.
Thank you. Yes. And again, if you're watching the recording at a later date, please feel free to send us any questions on our email. Dina, did you have another question?
Yes, I do, because I wrote it down. Okay, so I heard that like in Cuba, they developed a lung cancer vaccine. Do you think that like it could come to the US and help people? You know what I mean?
I have not heard of a lung cancer vaccine, but if you wanted to send us that information to our email, we'd be happy to read up on it. But there is presently no lung cancer vaccine available in the United States. The best preventive measure against lung cancer is smoking cessation. The best way to detect lung cancer early is through screening for high-risk individuals. And then is it Andrea, Crystal, Dharma? I think one of our questions that we like to ask folks who are so kind to let us come present are like, what are ways we can actually help your community get screened for lung cancer or learn about screening? Because we have these webinars. The issue with webinars is actually getting people to come. Like, do you have any guidance for us when it comes to what's the best way to reach, people in your community, to teach them about screening and help them get screened or talk to their physicians and providers about screening?
I know for me, like the faith-based community, and the only reason I say that is because I was on the fence. I was going to get the vaccination, but I wasn't sure about which one, and I was hesitant. But our church had this community roundtable, and they had some doctors, and our health department was there, and it just made me feel better. And I felt better that that information was coming from my pastor, someone who I trust. So for me, I think engaging with the faith-based community may help.
Definitely. Yeah, thank you. That's a great suggestion.
Sorry, Dina. You want to go?
Okay. Yeah, so I'm part of the Bosnian diaspora in the US. And like growing up, almost all of the adults, they're smokers. Does not matter if you're a man, woman, literally your parents and your grandparents and your great grandparents, they literally all smoked. I think it would be really important to reach out to like immigrant and refugee groups, especially in the Balkan Peninsula, because I don't know what it is, but they like when people smoke, they just don't smoke. They pair it with some other actions such as drinking coffee, which is like a social sort of thing. I think it would be important to reach out to like the Bosnian diaspora, and the largest is in St. Louis, Missouri. So.
Awesome. Thank you for that.
Mm-hmm.
Not a population that we previously knew of.
Yeah, it's really like out there, like every single adult I could think of, they're just smokers. So.
I like to add, I think you really need to get out and know the community and know who's in the community and getting to the whys they smoke. And like Andrea said, getting to the community leaders. If you get to the community leaders, and it doesn't have to be like an elected officials or anything like that, because sometimes they're not trusted. But when I'm saying community leaders, I'm talking about the people that the people in the community trust. You might call them Big Mama, you might call them, there's Joe Blow or whatever, but really getting out there and knowing who the people are in the community, that they're a trusted face. You can't just come in there and say, hey, we want to screen you for lung cancer. Hey, we want to talk to you about smoking cessation. We want to do that, but you want them to trust you first. And you want to build that relationship. And once you build those relationships, you're going to get to more of that. You're going to get to more of that.
Yeah, I completely agree. Thank you. Wonderful. Dina, any other questions that you wrote down?
You're so funny. Okay. I'm just like wondering, because it seems like a lot of females, they have a more what's called a more sensitive immune system. I'm wondering if one of the reasons why they develop lung cancer could be because there could have been some kind of like allergy or something, or I don't know. I'm just like contemplating in my head what it could be. Because like I took a class on what is called infectious disease at U of L. It was, what was his name? Well, there's an infectious disease expert there. I forgot his name. Oh, Dr. Paul Ewald, and he has done extreme like viral research, and he says that like the human body has been, what's it called, evolved for like thousands and thousands of years, and anything that happens in the body, it doesn't really happen by accident. There's usually some kind of outside force, and natural selection should have like tipped it to be gone from the population unless there was like an outside force. And I'm wondering if it could be like some kind of virus or some kind of like something going on, that yes, smoking is bad, but I'm just wondering about that 10 to 20%.
Yeah, I think those are all really, really great thoughts. And I think that right now with research, we are not there yet. We really do not know. But to tell you something a little interesting, so recently, ALCSI, we worked with Congressman Boyle from Pennsylvania and Senator Tina Smith from Minnesota to introduce Catherine's Law just this past June 8th. And Catherine's Law is in memory of Catherine Benson, who was 40 years old, a mother of 4, who was diagnosed with stage 4 lung cancer, had never smoked in her life. Sadly, she passed away just this past year. But what this bill is trying to do is open up screening criteria further, eligibility criteria, to allow people, if their doctor thinks they should get screened. So it's a little bit nuanced, but we're trying to make progress in this field of like currently, and I think everybody on this call knows, like when someone tells you they have lung cancer, what's your first thought? You go, oh, I didn't know you smoked, or wow, like, you always think about smoking. And so one of our initiatives, in addition to trying to get those currently eligible screened for lung cancer, is to try to change, the idea around lung cancer, that it's not just a disease that affects smokers, but it can affect anybody. And I think that changing that perspective is going to help propel research forward when it comes to looking at lung cancer in non-smokers and never smokers. But I really appreciate all of your comments and insight. And I think you bring up some really fascinating points.
Yeah, just like Alex said, thank you for your questions. We appreciate them. And thank you for your insights into how to better reach the community at large. We are so appreciative of your time to listen to our webinar today. And as always, if you ever think of anything in terms of questions, or if you want to participate, feel free to email us at info@alc.org. Rusab, did you have a question?
Actually, I don't have a question, but I would like to answer the question which Dina had asked. So she was asking about why do people who don't smoke, why they are getting lung cancer, why they are developing lung cancer. So basically any disease is linked with both the factors, genetic factors and environmental factors. So smoking is an environmental factor, but certain gene mutations, if they occur in certain tumor suppressor genes or proto-oncogenes such that they convert into oncogenes, then that can also develop lung cancer. So that's why it's important to know about the family history of lung cancer. So like some people who might have a family history of lung cancer, so the reason they might be developing a lung cancer might not be just smoking. There might be something else inside the genes which is also causing lung cancer. I hope that was understandable.
Yeah, it is with me because I've taken a lot of biology classes, but I think I'm gonna I'm gonna make it kind of with, if you didn't take too many science classes. So what is it? So when someone is like developing in the, like when a baby's being developed, there are these like cells and it helps like to proliferate. And then when the baby is ready to like leave, these cells, they kind of shut off so it doesn't get out of control. And a lot of the cells, they end up being switched, and that's what causes cancer, because there's like a switch on and a switch off. And if the cell gets switches on for the growth, it gets really crazy. So yeah.
Awesome. Thank you guys so much. I'm going to stop the recording here just so that we don't run over. And again, feel free to reach out with any questions. Thank you.